Good morning and welcome to Tuesday's Toolbox Talk. Today we're going to go through the display screen equipment assessments, or DSE. So the objective then is to ensure that all employees understand the importance of a DSE assessment, what they involve, and the occupational health risks associated with improper use of screens in the workplace. So what is a DSE, or display screen equipment? So DSE would include computers, laptops, tablets, smartphones, and any other display screen based devices used for prolonged periods of work. If you use DSE daily, continuously for an hour or more, you are considered to be a DSE user under the under the UK Health and Safety Display Screen Equipment Regulations 1992. So what should be covered in a DSE assessment? So firstly then, you're looking at the workstation setup, which would include the monitor height and distance, the keyboard and mouse placement, the desk space and layout, and then the chair ergonomics and adjustability. Your posture and seating. So ideally your feet should be flat on the floor or on a footrest. Knees at a right angle and the back supported, especially the lower back. Next then, looking at the screen position. So the top of the screen at or just above eye level. It should be an arm's length distance, and then minimal glare or reflection. Input devices. So the correct use and placement of any keyboard and mouse, and then wrist rests and ergonomic accessories if required. We then look at the environment where you're working. So the lighting and glare reduction, any noise levels, and the temperature and air quality. And then we have breaks and task variation. So you should be encouraging micro breaks and eye breaks, and the general rule is 20-20-20. So every 20 minutes, look at something 20 feet away for a period of 20 seconds. And then job rotation if possible. And then use of laptops and mobile devices, use of docking stations or external keyboards, keyboards or mice for long-term use, and avoiding awkward postures when working on the move. There is on my THSP website a how to set up your workstation poster. If you can't find it, please speak to your account executive. And this goes through basically what we've just gone through, but in a clear diagram showing you what should be in place. So occupational health issues from poor DSE use. So we have musculoskeletal disorders, or MSDs, and this would affect the neck, shoulder, and include back pain. There is also RSIs, or repetitive strain injuries, and then carpal tunnel syndrome. There is also visual fatigue from DSE use. So this would be through eye strain, blurred vision, and can include headaches. Mental health and stress. So long hours of screen use with no breaks can contribute to fatigue and burnout. And a poor posture and pain can also lead to decreased morale. And then we have sedentary lifestyle. So long periods of sitting can increase the risk of obesity, cardiovascular disease, and diabetes. So what control measures can we use? So you should carry out a regular DSE assessment, at least annually or when changes occur. provide training on the proper workstation setup, supply ergonomic equipment where needed, encourage movement and regular breaks, and promote healthy working habits. So employees have responsibilities under this. So complete a DSE self-assessment honestly and thoroughly. Report discomfort or issues early to your line managers. Adjust your workstation based on training and guidance. And then take regular screen breaks and move around. Like I said, if you have any questions, please speak to your AEs. There are forms and posters on your My THSP. And if you need assistance, there is a display screen equipment assessment also on your My THSP. And again, if you need assistance completing this, please speak to your account executive. Thank you very much.